Well, hello and welcome to this presentation on physical exercise and low back pain. My name is Ivan Duque. I'm a professor at the Universidad de Caldas in the Health Sciences faculty. And I'm looking forward to discuss this interesting topic with you over the next 5-6 minutes. Low back pain is a very important issue in health sciences around the world. It's a very common disease, especially in industrialized countries. And this is one of my field of research on sports sciences, on exercise physiology. First of all, I'm going to read a paragraph of an article published recently from it was written by authors in Sweden about low back pain. The conditioning is thought to be both a cause and a consequence of low back pain. The hypothesis of the conditioning syndrome is as a factor contributing to the chronicity of low back pain, form the basis for intensive physical rehabilitation of patients with low back pain. A recent study reported comparable levels of aerobic fitness in patients with chronic low back pain, and therefore questioned the deconditioning myth. Moreover, they reported that there is no association between pain intensity and aerobic fitness. They concluded that the conditioning defined as the lack of cardiovascular fitness levels normal for age and gender therefore does not contribute to pain intensity in patients with chronic low back pain. Well, in our laboratory, we measured physical fitness in those patients. The gold standard for measuring physical fitness is the maximal aerobic consumption, known as the VO2 max. This physiological parameter can be measured in patient subjects when they perform an exercise on a cycle ergometer. At the beginning of the test, the intensity of the exercise is not very high, but progressively it increases until exhaustion of the patient. There are several parameters that must be controlled during the test. First of all, the heart rate. Second, the lactate acid in the blood, and also the parameters of lung ventilation. With these parameters, we can measure the maximal aerobic fitness of the subject. And recently, well, maybe 10-15 years ago, the aerobic fitness was classified in different categories, depending of the value measured of maximal oxygen consumption, and also having to account the sex and the age of the subjects. For this research, we measured more than 130 patients, and we found that in general, patients with low back pain have a poor physical aerobic capacity, and it can be associated with the intensity and the duration of low back pain. Currently, the low back pain is a challenge for physicians, but we know now that physical training programs are one of the best tools for the treatment of those patients. There are several models for treating those patients. Often we find in the literature, in the scientific literature, programs during more than 1 month, more than 4 or 6 weeks of training on a daily basis of training. Often patients train for 2, 3, 4 hours per day, and we found that it's a very interesting alternative for the treatment of low back pain. Obviously, the intensity of pain and the disability of the disease needs very often the patients to take some drugs, especially non-steroidal anti-inflammatories, drugs, and some of them need at the end of the treatment to be operated from herniated disc in the spine. So now we know that one measure of prevention of low back pain, very important, is to have a active lifestyle and especially to have a high level of physical fitness. So this is a topic that I wanted to share with you. As a sports medicine doctor, I think that it could be very useful for you, and that's all for today. Thank you very much.